facelifts are very nice procedures that enhance the beauty of a patient tremendously. Typically in the late 40s and early 50s is when patients start noticing that sagging of the skin, particularly in the jawline, the formation of jowls, and with excess of skin and sometimes fat in the neck area. All of that coupled with a loss of volume on the cheek area that makes that skin sag even more. And the facelift addresses all that. So the facelift addresses the lower 2/3 of the face, and from the upper third, we consider that a brow lift, which some people consider as a part of a facelift, but in reality is a different operation. So when a patient is in the right height to weight proportion, and it's nice and active and athletic and things like that, that makes the ideal patient for rejuvenation. So restoring the anatomy in this part of the face, which includes the jawline, the jowls, and the excess of skin in the neck, has a tremendous impact on the way people judge their age. So it's amazing, but you subconsciously are kind of assessing people's ages by the way they look in this area. And you can see that with photographic evidence of patients before and after facelifts that show the dramatic improvement when you modify that area. Facelift is a pretty long operation. It takes me about 5 hours to do. And the care is done on an outpatient basis. We use a compression dressing at the end of the procedure, and the patient is seen in the office the next day to tell them how to do the care of the incisions and things like that. The recovery takes about a week and a half to 2 weeks to feel normal, but socially you're not going to be presentable for a good 3 to 4 weeks. So you have to take into account that, and if you have any big events, you don't want to do a facelift too close to that event. You give yourself a month or so or more, because more is better.